vaccine security for Africa. And in order to do that, we need to make sure that we have a vaccine that is appropriate for Africa. Africa is maybe not as developed as a lot of the other countries who can afford to transport millions of vaccine vials at -20 or -70 degrees. That is not something that is feasible for a lot of countries in Africa. So we have to make sure that we innovate so that we can get this vaccine to as many of the African citizens as we can.
Well, pleased to say the health reporter Laura Lopez Gonzalez is joining us now from Johannesburg. Laura, good to have you with us. So this is a really fascinating development. Just take us through it. There are scientists in South Africa reverse engineering that Moderna jab.
Right. So Moderna has said that it's looking at opening a plant in Africa. It's telling TRT World earlier this year that it spoke with several African leaders on the continent, but there's no sort of timeline for that factory. In the meantime, what the World Health Organization has contracted this Cape Town-based firm, Afrigen, to reverse engineer this vaccine, basically taking what we know from the patent application for Moderna and trying to see if it can sort of reverse engineer or kind of figure out the rest of the recipe for the vaccine. Once Afrigen does that, other countries from around the world will be invited to Cape Town to see how it's done and to be able to take that technology back to their countries to increase the pool of vaccine manufacturers. mRNA has been a super interesting technology for Africa, in particular because it's shown promise with other diseases of interest to the continent like malaria, yellow fever, and other mosquito-borne illnesses. So I think certainly a promising development. What really makes this key is that Moderna has said, listen, we're not going to share the technology with you, in part because the company doesn't think that it can do that kind of technology transfer while keeping up current production levels. But it has said it will waive its patent protections on the vaccine for the duration of the pandemic, which means that anybody who can kind of crack this code won't face any legal repercussions from Moderna for doing so.
And just on that then, I did see it reported earlier that you could do the research, but if you tried to do this commercially, there may be a problem with the patent. Just clear that sort of wrinkle up for us if you can, Laura.
Right. So unlike other mRNA manufacturers like Pfizer, Moderna has said publicly that it won't enforce its patent protections, which means that if you can crack that code and you produce it, Moderna won't come after you for breaking its patent protections. It says basically its CEO has said for the duration of the pandemic, anyone who can figure this out can't produce it, and we won't take you to court. So that's what has really been one of the keys factors in the World Health Organization deciding to pursue this mRNA vaccine versus any of the other ones we've seen come through the pipeline.
I mean, it's very giving of the boss of Moderna, but you know what would be better? Just giving people the patent details so they can produce the vaccine themselves in poorer countries.
Right. And I think that, it's also interesting to note that Moderna hasn't given any vaccines to COVAX, which, of course, is the only solution the world came up with for trying to ensure that poor countries had access to COVID-19 vaccines. Interestingly, Sanofi also recently released promising results from its mRNA vaccine, but quickly said it wasn't going to pursue that vaccine any further, citing in part the fact that the market has really been taken up by Pfizer and Moderna. We've spoken with activists from Doctors Without Borders who are calling for Sanofi to donate that technology to this mRNA hub based in Cape Town to allow for that to be taken up by other emerging manufacturers.
All right, we'll have to leave it there. Laura Lopez Gonzalez, excellent reporting as always. Thanks for being with us.